Good evening, everyone. My name is Brenda Alberg, Kenai Peninsula Borough Information Officer. And with me tonight is Dan Nelson, our Incident Commander, as well as a special guest, Ms. Leslie Phelps, Public Health Nurse in our Central Peninsula area with Department of Health and Social Services. Welcome, Ms. Leslie, and welcome, Dan. Thank you so much for taking the time out of your busy evening to join us tonight. And I'll start with Dan, if you could give us an update and welcome us to this 7 o'clock show.
Absolutely. Thanks so much, everybody, for joining us here at our Thursday night update and our conversation. So I don't have too much to report here this evening. We'll give most of our time over to Leslie, but I want to give a brief update on cases. So there were some updates today. 337 statewide cases have been confirmed positive for COVID-19. Still 19 cases here on the Kenai Peninsula. So we last had a change on that, actually last Friday the 17th. Of those 19 cases, 16 of those are reported as recovered. So that is an update from the state today. We continue to monitor and watch the state of Alaska and the governor's team in some of the updates that they have as related to some of the health mandates and the reopening of Alaska. So we're still watching some of that and getting information. Of course, we link all of that information on our kpboem.com and social media. From the borough perspective, we have been really kind of in a step down process for COVID response. As I've talked about before, we've had just tremendous planning with the cities, with the hospitals, all of our partners, and just great information and support from Leslie from the Department of Health and Social Services. So we have quite a number of contingency plans in place and kind of places to go if things ramp up again or as the situation changes. So that's really what we're doing. We're pretty much done with that. So we're at a point here where we're looking at borough operations and looking at things as we may be able to potentially look at different things on reopening and different operations from that perspective and what safety requirements are needed for that and really the details that might go on and go into that. So as of right now, I would remind people that borough and city operations, most of those operations are still closed to the public, but there are plenty of options to contact people by phone, on the web, by email, and that contact information is available online, or just give a call to the agency you're looking for and they'll be able to give you assistance. So keep in mind all those agencies and those services are still working, even if they're not necessarily available for walk-in traffic. That is the update I have. Like I say, I want to give some time over to our guest, and I think we've got a good conversation tonight, so I'll hand it back to Brenda.
Thank you for that, Dan. And Miss Leslie, thank you so much for joining us tonight. She is the registered nurse for public health in our local area. And if you don't mind giving us just a brief intro of what you do, where you're at, and we'll roll right into why you're here tonight. Are we having some technical difficulties?
Leslie, I think we got you back here. Let's see if we can get the audio to work. Leslie, can you hear us?
I can hear you. You guys went away for a couple minutes.
We're back.
You're back.
So I just did an introduction of you, but was going to ask if you could expound upon your introduction and why you're here tonight.
Okay, great. Well, thank you for having me speak tonight. Public health nurses are just, we feel very privileged to be part of the planning that's going on the Kenai Peninsula. Boy, there's a lot happening as far as planning for testing, alternate testing sites, alternate care sites, transportation, just huge amounts of planning with a lot of really great people. And we're really pleased to be a part of that. It's been a busy month and a half, I guess, going here. So we're excited to announce that we, as public health nurses, will be able to test for COVID-19. And so I'm happy to answer all the questions there is about that. Basically, we as public health nurses will be following the state guidelines that tell us the criteria for who we can test We will be testing symptomatic people. And the guidelines, as we know, are changing on a pretty rapid basis. The last update that we had was from last night, April 22nd. And the criteria are opening up. The signs and symptoms of this virus getting broader and broader. This is as viruses are, it's a strange virus. Lots of signs and symptoms. We've all heard that it doesn't affect children as much. We're now starting to learn that it may not affect people with respiratory complications as much as it's affecting people with vascular complications. So there's people with hypertension and diabetes may be more at risk than those with, say, asthma. So as we watch this and start learning more about it, we also want to open up some testing. We have public health centers in Homer and here in Kenai. We'll be able to test. We're going to ask you to call us so we can screen you before you come in and then make an appointment so we know when you're coming and be able to perform that test for you. We are not screening asymptomatic people. There's no good use at this point in time to screen asymptomatic people. If you don't have symptoms and you get a test done and it comes back negative, all you know is that for that short period of time when you had the nasal test done negative, but the test currently is a PCR test. It's very specific and it's a very effective test that we send to the state laboratories, but it doesn't tell you anything except for point in time whether you're positive or negative. We also have been working with hospitals and with other providers in other communities. So we have phone numbers for you for Seward and for Homer, for other sites to test. There's also a map that the state has pulled together that shows us different places within the state where people can go for testing. Let's see, what have I not covered, Brenda?
I think that's a great segue right into the mapping that we wanted to share, folks, and you can talk about that. I know Dan has offered to assist you with that. You can bring it up online and then we can walk through it if you're up for that, as far as where these testing centers are and how we could go about locating those. Dan, would you mind helping us out with that?
Of course. So I'll give just a moment here to get this set up, but the testing center site and where you can get some of that testing is located on the borough's coronavirus information hub, as well as some other places. But the easiest way to do that and get there is go to kpboem.com. And there will be a link there right on the top of that page on the left to take you to that. So if you access our website, you'll see that link right here, that kpb.covid19.us. That'll take you to our information hub, and you can access maps. And among those maps are our testing sites locator. So I'll just point out here, we also have some other maps that I've talked about in the past that talk about kind of businesses and services and what services are being offered for private sector businesses. So great resource here, but this map here will let you zoom into your particular location. If I zoom into the Kenai Soldotna area, you'll see the dots that indicate the different testing centers, and you can click on any of these for additional information. So this particular facility has their hours here of 8 a.m. to 4:30, their contact number, and some other information. And so you can look at these different areas and get contact information as well. And I don't know here yet, Leslie, if the public health centers are on this map yet or not, but I'm sure those will get updated since this is a kind of a fairly new development. So this is one of the best ways to get this information, and we've tried to put this kind of on maps for everybody in one central location. So Leslie, I don't know if there's kind of more to add on this one, but this is just a real quick overview. And once again, kpboem.com, and that's linked on the left-hand side, or you can go directly to covid19.kpb.us. Anything to add to that, Leslie, or did I miss anything on some of that mapping?
No, I think you've got it. The Kenai Public Health Center and the Homer Public Health Center should be on there. I was on the phone today with several providers around the communities encouraging them to sign up, giving the details of what kind of clients that they see.
And I think we froze on Leslie a little bit here, so apologies for the technical difficulties. But as I clicked on this, you can see that the Kenai Public Health Center is on there. And as Leslie mentioned, to be sure and give them a call. You're encouraged to go to your primary contact provider first, but give those folks a call and they can set you up an appointment. Remember that physical distancing is still critical. So we're making sure that we don't have a lot of different folks just kind of all in the health center at once. So that distancing is critical. So this shows the hours, so 9 a.m. to 4 p.m. For the Kenai Public Health Center. I think we do have Leslie back. We lost you again. We're having a little bit of technical difficulties, Leslie, but I was just talking a little bit about the procedure to call into the Public Health Center and to the importance of calling first to make that appointment so we can maintain physical distancing.
Yeah, perfect. Thank you. We did get Kenai and Homer Public Health Centers both on that map. And so you can find our number, give us a call. We'll get you all set up and get the testing. I think what people may want to know, a big reason why public health centers are now doing the testing, of course, is to get more available sites, to get more people tested. And our plan is to, certainly if you have insurance, to help you find a provider, will probably refer you there. But we are here to overcome any barriers. So if you have a high copay, maybe your provider hasn't had access to the testing material, and so we will test anyone. We don't bill insurance and we don't refuse anybody due to the inability to pay. So we're here to kind of fill those and help people so that they can get testing. But again, symptomatic, we'll go through the screening with you on what the current criteria is to get tested.
One question I had, Leslie, was is it still through providence.org or online as well through the state's coronavirus.alaska.gov site where you can look at the screening yourself? Or is it preferred that they actually call to be screened?
Well, it certainly, either way works fine. They can give us a call. And again, we'll take you through that screening so that we can get paperwork done ahead of time. Again, like Dan said, maintain that 6-foot distancing. We're not going to be sharing a piece of paper back and forth with you and a pen, that kind of thing. And we can notify you if you're going to, qualify for the testing. Again, the criteria has really opened up. If you do want to go to the state website, I think Dan was going to pull that up and show people where they can go see what the testing criteria is, keeping in mind that it changes frequently.
Thanks for that, Leslie. And I just put that up on the screen. So if folks want to see the most up-to-date information about that testing criteria, again, that's under kpboem.com. And you'll see right underneath that COVID information hub, you'll see a link to the Department of Health and Social Services. So it's, of course, so critical that you go to those websites, to the state website that has the authoritative information and view that up, because Leslie's folks keep that updated. But folks can see kind of the testing criteria on the screen here and some of those symptoms. And Leslie, I know you talked this morning in one of our planning sessions about how that those symptoms that are kind of meet that criteria have expanded. So I don't know if you want to address this while it's on the screen here.
Yeah, so what we know is that the symptoms of this virus are different than other viruses.
Apologies for that, and it seems that our technical gremlins here this morning, this evening, I don't know why I keep calling it morning, are catching up with us. So I'll just reiterate here that you can reach that on kpboem.com and link to the Department of Health and Social Services page. And I think Leslie's back again. We're dealing with issues. Leslie, do you want to go ahead there? We just heard you start speaking.
Yeah. So again, with all the different signs and symptoms with this virus, there's been an increase in people experiencing loss of taste and loss of smell. And of course, the typical fever and cough, but we're also seeing loss of appetite, sputum production, myalgia, lots of different symptoms. And it's not, again, we want practitioners and ourselves, of course, are going to include in that criteria. I mean, not just anybody that's got a little bit of a headache, but also where were you? Were you in a hospital? Is your spouse a healthcare worker? Have you traveled recently? Are you a critical infrastructure worker, which includes a lot of different people now that we're kind of opening up the state a little bit. So give us a call and we'll determine if we can screen you or not. And it's really opened up quite a bit.
All right. And once again, this website is up here, linked from kpboem.com. And you can read a little bit more about that. And as Leslie was talking, I was scrolling a little bit and seeing some of the different information that was on there. It's a really comprehensive website that the Department of Health and Social Services has provided. So again, all that linked on the same space. So visit our blog at kpboem.com. All those links are on the right-hand side.
One thing to reiterate, if we could also, is the testing going to be available for all, Ms. Leslie? And if not, why not?
Yeah, so anyone that meets the criteria that have signs and symptoms, we will test them. Sure. So that's any, age or insurance, no insurance. I can't think of any barriers that we would have other than asymptomatic. We're not doing any asymptomatic testing. The state isn't recommending it. And again, it just doesn't give us any information other than kind of a point in time count. So we're not doing a test so that you can get clearance to go back to work, so to speak.
And thank you for that clarification, because that is something that we get asked quite frequently is, do I need to have a test now before I go back to work? Or what if I don't show any kind of symptoms? Or why isn't everyone being tested? And it just comes back to also those supplies, and the medium needed to do testing is very limited as well.
So we know in the state of Alaska, we're a pretty creative state. We now are making our own nasal swabs and we're making our own viral transport media. So those are the two things needed for a test. And Alaska's pretty creative. We're making our own. And so we're getting supplies out to others who are testing, hospitals and providers. So that's really exciting. And it's crucial at this time because as we open up now, hospitals and other care centers are going to be doing opening up more surgeries and procedures, and the recommendation on Mandate 15 is to test everyone prior to their surgery. Again, what we're screening for isn't so much the negatives, but we're looking for the positives as they go into surgery or go into their procedures to protect our healthcare providers and to learn if this person has the illness. Then, of course, then public health nurses do their other job, which is really huge, and that's the contact investigation that we're still doing. And again, that is the most effective way of interviews to find who else was in contact with that laboratory confirmed case. And then we work with those people, put them in quarantine and stopping the spread. And I just have to say at this point that, the Kenai Peninsula hasn't had a lot of positives, and I just have to applaud
Giving it that pause to see if Miss Leslie comes back for us. Having those technical difficulties. Oh, we're waiting for Miss Leslie. Are you there? You are, Miss Leslie. We got you back.
Okay, there we go. I don't know where you stopped hearing me.
I think you had done really well as far as wrapping it up, and just the importance of having the ability to get those supplies to other areas based on our creativity. And as a result of the Mandate 15.
Yeah, and then just applauding everyone and thanking everyone in the community for following the mandates, doing the social distancing. That's what's kept our numbers down. It's not just one thing. It's not just testing, or it's not just contact investigation, or it's not just social distancing. It's all of our efforts that have kept our numbers down, and we'd like to keep it that way. We want to dig out any more positive cases. We want to find them really, and we want to get those contacts so that we can just get this thing out of the state.
Very well said. A couple of questions that we have in our comment threads, if you don't mind. We'll try to see if we can't get answers. If we can't, we can. One of the questions is, will there be testing to find out if we have had COVID and recovered?
Okay, so we're now talking about antibody testing, and that's a great question. Thank you for that. Antibody testing is not recommended so far nationally, and certainly the state of Alaska is recommending it. The tests that are doing for antibody testing, there's a lot of different ones out there. They're not all FDA approved. Currently, they're using them in large populations like New York or California for epidemiologists to be able to kind of see what's going on with this virus after you've had the disease. How long does it take you to build immunity? What kind of immunity are you developing? Is that immunity going to work to prevent you from getting the illness again? There have been some people that have had signs and symptoms resurface, and they're not sure if that's the same illness coming back or a new illness. So antibody testing at this point just doesn't give us the kind of information that says I can look you in the eye and say you have antibodies and now you'll be cleared from the disease. We're just not there yet.
Okay. Is there a possibility that you may be able to provide us an update on the vaccine efforts?
I haven't heard anything recently from the state of Alaska, from our doctors there, just what I've heard on the national news. And I hear that still maybe a year out. I'll tell you what, I'm real excited to hear that. And I would be so happy if they came out with something this fall. That would just be exciting, but I don't have any more information on that.
Okay. Then one of the other questions with regards to the mandates 15 and 16 rolling out for those businesses that will be allowed to open in phases, and of course with recommendations. How is that at all in line with the CDC recommendations? And the reason I think where that question is coming up is based on your comment that it's still very important for us to be following the CDC requirements. And so maybe that is the question, was the rollout in line with the CDC requirements? And could you expound on some of that? For example, the masks that are also being asked to be worn in our businesses.
So are you talking about the rollout of public health nursing being able to test it? Or are you talking about
the businesses, the mandate 16 and 16 predominantly about businesses being able to open, and just reiterating the importance of the CDC requirements for prevention, the prevention activities, and some of the requirements are also including masks that you have to wear and why that's so important. Could you expound a little bit on that?
Yeah, sure. We're not ready yet. We're still getting positive tests. We're still on that upward slide, even if we've kind of mellowed out a little bit there. We still want to prevent this illness. And I think that trying to get people back working in society and get us back engaged more, knowing that people are smart enough now, they realize what the social distancing has done, and we need to maintain that. But I think we're all adult enough and have learned enough to know that, yeah, we can go to the grocery store and social distance. We can go to a restaurant. We can start engaging more in social activities, but it's really important to continue that social distancing, that 6 feet, not shaking hands, avoiding hugging, those kinds of things. The masks, we certainly, when we're wearing a mask, we're preventing our own spit, if you will, from contaminating someone else's airspace. So it's not necessarily protecting ourselves. And we know that viruses are teeny tiny. I mean, it's very difficult to spread this, to stop the spread of viruses The masks, I think, can and do reduce the distance that your air travels, and it's a reminder for all of us too, I think, to maintain that 6-foot distance.
Coming back to testing, what can folks expect if they want to be tested either at Homer or the Kenai facility?
So you're going to give us a call, and we're going to do, get some of your demographic information over the phone. We'll answer some more of your questions. We'll talk to you and screen you and see if you're appropriate for testing. We'll get your email address so that we can send you some information that might help answer your questions, like what needs to happen after testing, that kind of thing. We'll make sure that you know where to go, where we're located. You will drive up. We'll need you to have your driver's license or form of identification. We're going to have you roll up your window, show your identification, and then you're going to pull up so that you'll be very close to a platform that's going to have the test material on it, a test tube and a nasal swab. You will, the nurse will step back. You'll reach out your window, grab the test equipment, and you'll take the swab and you'll put it up your nose, and it'll be uncomfortable and you're not going to like it very much, but that means if you don't like it, you've got it up your nose far enough. You'll take it and then you'll put it in the other side, put it in the test tube, break it off, put the lid back on, put the test tube back on the table, and you're done.
Good to know. Now, with that, you had said if folks would have to, or you would be getting their email address to provide them additional information. What if someone doesn't have access to email? How will they be able to get the information from you?
Yeah, so we'll be providing all of the information when they call us on the phone. That's not going to be a barrier. We'll figure out another way. We want to get them information on what I kind of just told you, and so now everybody knows anyway, so you won't need that sent in your email to pass that out. So it may be that we can show that to you in your car when you drive up. You know, this is all new. We've not ever been in a pandemic before, and so we just ask for your grace as we sort of figure this out as we go. But we're sure happy to be able to test as many people as possible.
And I think that's a great segue into just acknowledging how everyone has worked so well together, the patience that has been exuded, the grace that you're talking about as we continue to adapt and change and improve methodologies throughout this pandemic response. Leslie, I was going to ask you for some closing comments or some key messages that you'd like to share with our audience tonight.
We've got some phone numbers, Brenda. I don't know how you want to share those. We've got a number for Seward. We've got a number also for Homer, South Peninsula Hospital. They're doing extensive testing there. And then, of course, the Public Health Center and Homer Public Health Center. I think it's just crucial to remember that we're not doing asymptomatic screening at this point in time. We're testing. We're trying to find people that are sick. That's important. We're happy to test anyone. I'm just checking my notes real quick. And I think that things will change over time. We're trying to get more testing available in other communities on the Kenai Peninsula, so stay tuned for that information as well. Yeah.
Would you like to share those phone numbers now? And we'll make sure I put them in the comments for folks as well.
Sure. So Kenai Public Health Center, if you want to come here for a test, is 335-3400. Homer Public Health Center is 235-8857. And South Peninsula Hospital, that's where they're doing a lot of testing down there. They can drive up to the emergency department and get testing there. They're testing everyone. Their number there is 235-0235. And in Seward, you can call the clinic there. They'll get you lined up with testing. That's 224-2273.
All right, I'm going to put those in the comments, and I'll make sure that we pin that to the top of this Kenai or community conversation. Dan, I'm going to turn it over to you for some closing comments tonight.
Thanks, Brenda. And I want to thank Leslie for joining us tonight and being able to talk with us a little bit on testing. And certainly that's been something that's been on everybody's minds throughout these conversations. And really it's seeing some great success and being able to get more of that testing. We're certainly seeing more availability than we had. And I think it's very interesting and a good show of resilience of making our own test media and being able to do those things and really being able to turn things around and build up on that testing criteria to allow for more. And more of that data just allows us to all make better decisions and to make some better plans. Remember that as tomorrow the governor has modified some of those mandates effective in the morning to be able to open up some of the businesses and things. And I've certainly seen here in the local community some of those businesses responding and letting folks know how they're going to be keeping people safe while they're patronizing those businesses. I really can't stress enough for everybody that keep that physical distancing, that at least 6 feet. We're not out of the woods yet. We're doing good things. We've all done the right thing. We're getting us to a point where we can be a little bit more flexible, but everybody please, don't think this is the end of everything, and then still precautions need to be made to take care of ourselves and our neighbors. So not to end on a negative note, but definitely want everybody to remember that. Besides that, I hope everybody has an opportunity to get out and maybe enjoy the weather a little bit. I know it's been kind of gray and rainy here in the Central Peninsula, so it kind of depends on what you're interested in, but hopefully you can get out of the house and maybe be able to do some safe physically distancing type activities for the weekend. So with that, I think that's a good point to wrap it up tonight. Once again, thanks to everybody for joining us here on KPB Alerts. Leslie, thank you so much for taking the time tonight, and Brenda, as always, for moderating and keeping us on track. We're still fighting those technical gremlins, and we're about 6 or 7 weeks into this. So appreciate everybody's patience. Have a very wonderful weekend, everyone, and we'll see you again here on Tuesday. And I just want to point, sorry, not Tuesday. That leads me into a final point I was about to leave, that we're going to change the schedule for these community conversations. So with things kind of being a little bit more flexible and with some of those news updates not coming so frequently, we'd like to change this schedule to accommodate that and to be respectful of everybody's time. So beginning next week, we'll do this once a week on Wednesday evenings. So Wednesday evening, 7 p.m. here on KPB Alerts on Facebook and YouTube. We'll get that out on our social media and kpboem.com, where you can see all the links for everything we talked about tonight. So now I really mean it. Have a great weekend. We'll let you go, and we'll see you next Wednesday, 7 p.m.